Hello, everybody. Dr. Ashley Oxner here. Today, I wanted to discuss something that we get a lot of questions about for obvious reasons, kind of like our friend Kramer here, who's literally beside himself, and that is chiropractic for kids. So it's kind of a outlandish concept for many people to even consider, mainly because they simply don't get it. So when we talk about not getting it, they haven't been educated about it. They don't understand the purpose behind it, the reasoning behind it, or why it's even important, and many times critical and necessary. So if you're in that boat of where you just don't get it, or you don't understand it, you just don't see it, then this video is just for you. Even if you're someone who might have used to take your child to a chiropractor, you no longer do, or maybe you fell kind of off track, this video is for you too. And for those out there who have like a personal vendetta against chiropractic, this video is definitely not for you. I can tell you that with 100% certainty. So let me share first, I want to break down the misconceptions that people have, because once you can kind of get past those, inevitably you'll start to get it and then see that there's a purpose behind it all and why it is so important. So to start with, the misconception number one, as you can see over my shoulder here, is that not just with kids, but with even adults, that chiropractors are just going to like decapitate and pull your head off. Couldn't be further from the truth. The misconception number two is that when you bring a baby or a child in, this is going to happen. So you're going to see twisting and turning and cracking and snapping of the baby's neck or the small child, which doesn't look anything like that when administered properly. In fact, very minimal force, so specific and gentle. Many times you can't even tell we did anything. The other misconception then, because of the first two, is that when you start to think about these two misconceptions, you think, oh my gosh, what is this doctor going to do to my baby? And you think that we'll do something like what you're looking at there on the screen, where we just shake and twist and turn and pull, and that's just not what happens. So what I want you to do for a minute is just kind of contemplate and think about this, okay? So number one, doctors of chiropractic have been around for hundreds of years now, and we're also now licensed physicians. So in the state I practice in, Illinois, I'm a licensed chiropractic physician. So the state gives me a license. I also have malpractice insurance, which, by the way, is cheaper than a pediatrician's malpractice insurance, which means I'm lower risk. And we have all these things in place. So if it wasn't safe and it wasn't something that had value or benefit, would those things even exist? Meaning having a license, right? And being able to be insured, right? Of course they wouldn't. We'd have like a clinic in a basement somewhere that you'd have to have like a secret knock to get in. Just not the way it is. It's absolutely an accepted treatment, an accepted modality, an accepted tool for many parents, especially for their children. So think about this too. I want you to think about why then would we need to take a child to the chiropractor? Because rarely does a baby tell you they have neck pain. Rarely does a child say, oh yeah, my back hurts or my neck hurts. They might say their knee hurts or they've got growing pains, but kids don't have that ability to communicate quite yet. Young children especially, I'm talking about what's going on with their body. So here's why. And I want to show you some pictures so you can understand this, because the birth process itself, and we could even start in utero when the baby's in the womb. There could be malpositions, malpresentations, cords wrapped around necks, etc. However, when we get to the actual birth, notice in these pictures here that there's a lot of force being applied to the spine of the baby. So in the picture over on the left, you're looking at a cesarean section, and the cesarean section, they're literally pulling and twisting that baby out. There's literally two sets of hands on this child to try to remove it from the mother. Now, notice right there, that's the neck muscle being completely strained. That is a lot of force going through such a delicate spinal column and nervous system. So important to understand. The second photo here, that's a vacuum extraction where they put a suction cup on the head instead of pulling and twisting with the hands. The suction cup goes on, and then they pull the baby out by the skull. This too puts an extreme amount of force through the baby, as you're going to learn. And then this one here is an actual vaginal birth where it looks like they're trying to remove the head, not actually administer a birth. So things to consider on the why side. So behind it all there is the nervous system. As you can see on this picture, the brain, spinal cord, and nerves are what run and control the entire body. So the messages from the brain, like an electrical impulse, go over the spinal cord, out the nerves to every cell, tissue, and organ in your entire body. Same thing for the baby, right? Running and controlling it, making the lungs breathe, making the heart beat, helping them stay in total balance, as you're going to see the importance of that in a minute. Well, here's those intervention effects from a research standpoint. So vacuum extraction, by the way, can transmit up to 120 pounds of force through the infant's cervical spine. That will damage spinal joints and nerve tissue. Keep that in mind. It's not like you would go around handing babies to each other, holding them by the head. We just don't do that, yet we use the head to forcefully remove the baby in birth process. Sometimes necessary, I get that. However, birth trauma also causes this. Lewitt found that in 92% of kids with chronic tonsillitis, they had a reduction of that after they corrected the C1, C2 vertebrae that was out. After they corrected it, the tonsillitis went away. That's because those nerves go to the immune system. The other research here shows that up to 80% of all children are not in autonomic balance after birth trauma, after these effects and having a C1 top bone in the neck that's misaligned, that's subluxated. As well, Dr. Abraham Tobin, who's a Harvard researcher, found that spinal injury from the birth process is responsible for SIDS, sudden infant death syndrome, in 7 out of 8 autopsies. So birth trauma is real. We can't ignore that. And these are the severe cases. So imagine where there was a birth process in which maybe there wasn't, say, a severed nerve, or maybe there wasn't SIDS or a complete dissection of an artery or something like that, right? Let's just say it was a very small shift in the spinal column that put pressure and irritation on the nervous system. Here's what can happen over time. This is key to understand. Pay attention on this part. Your nervous system has 2 components. You've all heard of probably the fight or flight component, right? When you see a bear, you freak out, your heart rate goes up, your adrenaline pumps, and you run. That's the fight flight. The rest digest side is where we're in total what we call parasympathetic dominance, where we're just at ease. Okay, we're in tone. Rest, digest, fight, flight. Well, all of those traumas from the birth process, it could have been exposures of the mother to toxins during the pregnancy, EMF, so on and so forth. A ton of different interferences that affect the nervous system of the child as they grow and develop, kicks them into what we call fight, flight, dominance. So that's sympathetic dominance. So it goes something like this. Boom, you're running down the road. You can't see where you're going. Your foot's locked on the gas like Tommy Boy here, and you don't know what to do, right? The body doesn't know what to do. It's just responding to these stimuluses. It's just responding and reacting to stimuluses. Sort of like if your gas pedal's stuck in your car, like you see on this guy, out of control, blasting through a wall, can't hit the brakes. That's the idea. So when we have a child, especially starting as young as an infant, that's now locked in this fight flight dominance and the gas pedal's floored, we need to do something to obviously pump the brakes. We need to apply the brakes, stop, slow it down, and get this nervous system back into balance. In fact, that's basically what happens when someone's trying to comfort a child and you're holding the baby and bouncing the baby like our friend Bradley Cooper here. By the way, moms, I would assume if Bradley Cooper walked in and was trying to comfort your baby like that, you'd be in sympathetic fight, flight, dominance, probably freaking out because Bradley Cooper's in your house. But side note, yes, we want to calm the baby. We want to get that rest, digest, parasympathetic stimulation. Well, guess what? Chiropractors who are pediatric and family chiropractors know how to do this through the spine and the nerve system with very gentle and specific techniques. This is something that I do. This is something there's a lot of doctors out there that do. And it's so important to get your babies checked. So important. You can set the child on a different course for life by getting their nervous system checked at birth, or at least as close to birth as you can. They might be 3 years old by now. That's okay. Things can be corrected that have been there for some time. All right. So little Carolina here got her first adjustment within weeks of her birth. All 4 of my children have been checked within minutes of their birth. Okay, and then as the children grow, yes, we want to obviously continue to check them and to continue to make sure that their spine and nerve system is aligned, that it's growing, that it's in the right state, so that we can turn around some of that sympathetic overload, sympathetic dominance, that fight-flight dominance, bring them back into balance, so that then things like, for instance, colic, things like digestive issues, reflux in babies, things like recurrent illnesses, things as the kids grow when we look at ear infections, tonsillitis, chronic respiratory recurrent issues with that. We'll see kids as they even get older that have been then diagnosed with things like attention deficit hyperactivity disorder, ADD, ADHD, right? Locked in sympathetic dominance, where the sensory system has now caused behavioral issues. So we'll see all these things, and they continue to transpire. And if we just allow these imbalances to exist, we don't even know what's possible for that child. That child's potential can't be reached. So I couldn't encourage you enough to always get your kids checked. This is how we do it. It's the evaluation is extremely simple as you watch it, but very in-depth and profoundly powerful as you look at what we do for the exam. We start with the health history and consultation. I need to know what happened during the birth. I need to know what happened during the pregnancy. I need to know the entire history. I need to know everything. Then you can see and start to kind of connect the dots as to what might have led the child to where they're at today. We'll do any possible orthopedic, neurologic, range of motion, or palpation tests. Now, many of these are specific to a child. Of course, depends on if it's a baby or a toddler or whoever, or their age. But what I'm getting at is very detailed evaluations so that you can see, and I will point out to you where there are issues, subluxation, that are leading to this dominance in the sympathetic fight-flight reaction many times. We'll do digital posture. If we can't do posture on a baby, obviously, we're going to look at skin folds, different trends that we see, and how their body's posture is aligned. We'll do, in some cases, severe cases, especially of kids who are upright and that are absolutely walking and holding themselves, we'll do digital motion study x-rays, or we'll do postural x-rays to see exactly what's going on. We've picked up and diagnosed scoliosis before that have been missed by the pediatrician. We don't want to miss these things. You want to catch them as soon as we can, because the good news is, at the report of findings, which is the last step there, I'll give you all the findings, all the recommendations, show exactly what chiropractic can do for your child, not just in a reactive sense, but in a proactive sense. We're talking about their future. We're talking about kids, their lives. This is our next generation. So I'm passionate about this. I hope you can feel that. I want to see your children and everybody's children be at their peak potential, because the kids today are up against enough. They've got enough stress. They've got enough things to consider to handle as they grow. They shouldn't have to have a spine and a subluxated spine and structure that's going to also limit their potential. Okay, so I leave you with this question from our friend Bradley Cooper again. Why not, right? Why not? Why not get your kids checked by a qualified pediatric and family chiropractor? In my opinion, you've got nothing to lose. So I encourage you, take this up. In the comments, if you're needing a chiropractor in another area, go ahead and just put that in there. We'll be happy to find you somebody. If you're in the Illinois area, in the Midwest here, you can schedule an appointment in our clinic. We'd be happy to see you. Okay, that's all I've got today. Have a great one. Take care.